We just assume that the practice of medicine does more good than it does harm. We look at all the technologies that we have that are incredible. We have gene replacement therapy, we have stem cell therapy, we have microsurgeries and technologies that can blow your mind. We even have robotic surgeries that are done. And you'd have to think it's got to do more good than harm. But yet a study has never been done on this, and so it leaves the science part of this in question. It's interesting that there was an article in Archives of Internal Medicine in February of 2012 that studied 36,000 patients for 4 years, and they measured the satisfaction patients had for the doctors. And what they found is that those patients that were satisfied with their doctors, the most satisfied with them, had fewer emergency room visits, but to the shock of the authors, they found that there were 26% more deaths. How does that happen? Well, the satisfied patients spent 9% more money on health expenditures in general and 9% more on drugs. They got more treatment. Could it be that some of the treatments are causing problems? We've talked about the fact that there are lots of screening tests that are done in medicine, and we just assume that because we do early detection that we're doing something that provides a service. But the question about overtreatment has come up as well, and that changes things. We don't really know what the effect of that is, and it gets kind of worrisome. When you look at the number of deaths that there are every year at the hands of physicians, at the practice of medicine, that number is staggering. And until Gary Null did his study called Death by Medicine, we didn't know what that number really was. He collected all the pieces and found that 400,000 people die every year from pharmaceutical drugs. More than 100,000 in hospitals alone die from the expected side effects of drugs. Then there are the mistakes that are made and patients not taking them properly, or they're not being dispensed properly. That adds up for the rest of that. We have infections that occur in hospitals that are called nosocomial or hospital-acquired infections. We have people dying from errors that are made from all kinds of things, the wrong surgeries, surgeries that need to be done. And when you total all that up, it comes to about close to 1 million deaths a year. Now, I was shocked when I saw that number, but it also points out that we need to look more carefully at the number of deaths that there are. And we need to start measuring how much good are we doing. We know that we're over-testing a lot of our patients that come to us. There are conflicts of interest, which means that discretionary tests, or those that don't necessarily need to be done, but might give some peace of mind if they were, and they came out right, lead to lots of iatrogenic harm, which means that it leads to too many tests that cost money, it leads to too many procedures that are done, and sometimes those procedures are dangerous. More care is not necessarily better care. So I think that when medicine is used wisely, it has to save lives. I can't believe that it doesn't. But when we have all the conflicts of interest, we have the deaths that occur because of mistakes and because people are just not taking enough time to get things right, and we're not personally engaged in the lives of our patients, it makes a big difference than when, for example, we have our own wife in the hospital or a family member. All of a sudden becomes a different situation. So is medical practice more harmful than good? We don't really know the answer. I'd like to see more studies done, and of course this study that was done in Archives of Internal Medicine is pretty upsetting, because it's showing that those patients that are the most satisfied with their doctors, that are getting the most care, are having 26% more deaths.